Oh, these awards are amazing. It's just so important to hear all the amazing work that's happening across London. I mean, there were some that I knew and there were so many that I didn't know. And I heard you had so many nominations. So it's just really, really exciting. And I think for us as NHSE London region, we're really trying to look at how we create the infrastructure to ensure that all the good work that's happening to support neighbourhood health can be sustainable, and to make things actually easier to do on the ground. The work is happening on the ground. The neighbourhood experts are the people that are delivering it. What we need to understand is what's happening, what makes it hard, what works really well, and what we can do to support.
A meeting that gives recognition to people delivering that care, I think, is really worthwhile. I think it will encourage people to do more. But more than anything else, it's just really important to say thank you when people are going that extra mile to deliver this kind of care.
So tonight's a brilliant celebration, and it's quite tough in the NHS at the moment. Money's pretty tight. We've heard from some of the speakers on the stage today that the demographics are pretty difficult, and so people keeping their spirits up at times like that is quite a tough ask. We need to take the really good examples we're hearing about tonight and roll them out to the whole population of London.
As doctors, we've all been trained in biomedicine, but the 80% that comes from personalised medicine is absolutely vital. And it's the thing that's actually going to make all the difference in terms of quality of healthy life expectancy, which is about to reach 20 years difference between rich and poor. But that we know that when you take a personalised approach, when you socially prescribe, that can reduce consultation in general practice by 40% and 20% in the hospitals. This is really powerful stuff, and with an NHS that is really stretched at this moment in time, really quite crucial, and it's a win-win. It's good for the NHS and it's certainly good for patients.
We've got a programme across London which brings together local authorities, health, community sector, local communities to make sure we shape things that actually meet people's needs, and celebrating and looking at that is incredibly important.
I think improving health is there, but it's not evenly distributed. So the fantastic thing about the 7 projects led by all the 7 PCNs is that the PCNs are leading that inequality work.
What we are looking to do is make sure that no one's left behind. A lot of our work is around encouraging patients, especially those from an elderly population, to get involved with digital tools and accessing their health, especially as we know the 10-year plan of the NHS is naturally to move towards the NHS app being the front door.
The Universal Care Plan over the last couple of years has been working with the NHS app team to create edit functionality for patients across London. So at the moment they can view their UCP via the NHS app, but soon a patient will be able to log in, they'll be able to create one from scratch, they'll be able to edit it with their personal information that they wish to share with health and care professionals, so that when an ambulance gets called out to them, that ambulance crew will be able to see the Universal Care Plan, they'll be able to see what the patient has entered about themselves, and therefore they can hopefully provide a more intimate, personalised care that's going to have a better outcome for the patient.
So in Waltham Forest, we've been working very collaboratively. In fact, in March will be 10 years that we've been working social prescribing, public health, and in particular the primary care. And some of the primary care networks have been absolutely inspirational in how we can work together and how they can champion working with social prescribing, not only looking at the patient from the medical point of view, but holistically as well.
I think the role of the health coach and the care coordinator is just really, really important because it's a grassroots level post, and health coaches in particular are able to ask patients what matters to them, often in the non-clinical environment, and patients are really able to express what's important to them about their health and how in fact the neighbourhood and the community can support them to better manage that.
There's enormous expertise in certain pockets of parts of London which have worked with communities for years, and then there's other communities very similar in another part of London, and it's vital that they can share together and they can come together and we can build on that expertise across different areas.
It's a terribly humbling experience. I'm just thinking about all the teams that have been working behind the scenes to make this vision come true. So for me, it's a real honour and privilege to be here tonight.